Hello,
Hi.
my name is Dr. Brian Camille and I own Premier Health of Golden Valley. This is Dr. Kelsey Camille. She owns our Premier Health of Coon Rapids. So in this time of us doing our social distancing and all that good stuff, we're teaching some different kinds of things that we can be doing at home. Now, what we're going to be teaching you is some trigger point for the upper back and neck, and these are the same things that we teach in our office. So we're going to give you the base material now, and if you want to learn more of it, you can always feel free to set up to come into the practice on the nights that we teach this, and you can get it done in person. So we're going to start with some trapezius work, or your shoulder on top here. So Kelsey, can I have you sit? Can I have you face this way? All right. So we're going to start with what's called trapezius, and trapezius is a tissue that comes from here and then just goes right down to the shoulder. Now what we're going to be doing is we're going to try to do the laziest amount of muscle work that we can do. So essentially we just want to use our body weight. This is going to be a two-person job. So our job is to locate a trigger point, and all that means is we're going to come across the top of the shoulder and we're just going to locate a spot that feels a little bit more tough. Healthy tissue feels like a filet mignon. Tissue that's been tight for a while will feel kind of like an overcooked steak. So we're just looking for something that has a little bit more of that steak feeling. And for Kelsey, you can feel it right through here. Now, we both have a job during this. Kelsey's job is to go through range of motion. So it's going to look like this. If we're working on the left side, Kelsey's going to begin by looking to the right. So Kelsey, can you look all the way? There you go. She's going to take a deep breath, let it out. And now she's going to turn nice and slow at about this speed, going from her right all the way to her left, breathing normally. At the end, she'll take a deep breath and blow it out. Perfect. That lets her breathe through it. It makes it a little bit less obnoxious from a feeling standpoint. It's also going to keep her from fainting. People like to hold their breath when we do this. So now my job, I'm going to put a thumb on top of that trigger point and another thumb on top of that trigger point. And I'm just going to leave my body weight down on it. Just using body weight alone, that way we don't have to exert a lot of force. When we're doing this movement, whoever we're working on, we don't want that discomfort to reach maybe a 6 out of 10. Once we get past that point, they have a tendency to want to fight with us. And if they're resisting a little bit, nothing's getting done. So we're going to get right on top of that trigger point. Kelsey's in her start position. She'll take a deep breath. Blow it out. All the way, all the way, all the way. She'll get to the end. Take a deep breath. And blow it out. Beautifully done. So anytime that we're doing this, we're doing it in a set of 3, okay? So if we're going to be going then to the right side, obviously we'd be doing the exact same procedure we just did. We're just mirroring which way we're starting and which way we're moving through it. So that's trapezius, one of the most important muscles of the upper back and neck. Thank you.